Hello, I'm Natasha from the NIHR Greater Manchester Patient Safety Translational Research Centre at the University of Manchester. I'm going to talk today about a systematic review and network meta-analysis of transitions interventions from hospital to community or primary care. So a bit of background. The transition from hospital to community or primary care is often described as a vulnerable pinch point in the patient journey that's associated with numerous harms. A number of systematic reviews suggest that transitional interventions are promising for improving care and patient outcomes. However, at present, it's unclear whether the complexity, for example, the number of components, and the stage of the transitions process, for example, pre-discharge, post-discharge, or something that bridges the two stages of transitional interventions drive the obtained benefits. So the methods. We conducted a systematic review and network meta-analysis. The population that was included was all patients in hospital, irrespective of age, gender, or condition. The interventions that were eligible for inclusion were randomized controlled trials evaluating the use of a discharge intervention that measured readmission. The comparator was usual care or treatment as usual, and the primary outcome was 30-day readmissions, although we did consider other time points such as 60 days, 90 days, 180 days, and 365 days. And the secondary outcomes were mortality, emergency department visits, quality of life, satisfaction, medication adherence, length of stay, primary care or outpatient visits, and intervention uptake. The key findings were that low and moderate intensity interventions were associated with reduced odds for readmission. Low intensity interventions were associated with a 1.5-fold decrease in emergency department visits. High and medium intensity interventions were most effective when delivered within the first 6 months. High and moderate intensity interventions were associated with a 2 to 5-fold increase in medication adherence. So in conclusion, examining the effectiveness of interventions of different intensities is important for understanding which transitional interventions are effective in improving outcomes. Understanding the effect of complexity and intensity of discharge interventions should be considered in future design. And this evidence was derived from interventions evaluated in diverse groups of patients and healthcare settings. Thank you for listening.